Hey everyone, today I am with Rhea Schmidt of Grow Well PT, and she serves the littles in California. So Rhea, welcome, and I'm excited to hear about who your clientele is, who you serve, and where you serve them.
Thanks for having me. I live in Torrance, and so I serve Torrance, California, South Bay area of Los Angeles, and then the surrounding areas, which includes like Redondo Beach. Typically I go as north as like El Segundo or Manhattan Beach, and then as south as Rancho Palos Verdes and South San Pedro, that area. I serve primarily 0 to 3. I really love, I know, I am just so obsessed with babies. And it's just kind of a growing obsession. But I will serve newborns up to school age. The majority of the kiddos that I see are 0 to 3.
I love kiddos 0 to 3 too. They're definitely my favorite. You can just like kind of put them in positions and teach mom so much. And I know that you, like me, go into the house. And so you serve parents in their own home with their own belongings and their toys. And like, if mom has a new baby, maybe she's in her pajamas drinking coffee. And a lot of times that's okay with us, right?
Yeah, absolutely. I really built my business model based on my own experiences as a mom. I have 2 daughters, and hands down the most kind of challenging thing I've ever done is raise babies. It's just, very physically grueling on the mom, emotional, everything. There's so many changes that you're going through personally and having to learn. And my own experiences becoming a mom, I just wanted to be able to support new moms. And I think that a lot of new moms have so much pressure on them these days of becoming like experts of every single topic. Like there's so much information floating around, whether it be on social media, and so much pressure for moms to like develop expertise in like their baby's motor skills and nutrition and breastfeeding and sleeping. And there are so many aspects of that I found myself as a mom going crazy. So I really kind of tried to develop my practice in a way that is there for parents and the family and really supports them just as much as the kiddo.
You bring up like a huge point because obviously I have a YouTube channel and I know you have an Instagram, and having the information out there and available to parents is both like a high value of ours. But I think it's also really important that we have these services. We don't expect you to be us. Like whether it's before we meet you or during the plan of care of therapy, if your kiddo does end up needing that. But what we want to be is like heartfelt guides to help you navigate, fill in the gaps, and then teach you the things that are low stress that you can do and fit into your everyday life through like functional play or positions that actually helps your relationship and you to connect with your baby.
There's so much noise out there. There's a lot of good noise, but it's just a lot, I think, for anyone to kind of take in. And especially when there's something that doesn't necessarily seem like it's developing on the right trajectory, whether, your kiddo's not crawling or they have a head turn preference or just something that makes your like radar as a mom go up. I really want to be able to support parents in a way where they don't feel like they have to go out and do all of the research. They can come in and we can show them the hands-on techniques that are super simple, but very directed towards their individual child, and just help them rule out things and decrease the worries that they're feeling, because there's nothing more stressful than having these worries about your own child and their development and how they're going to be. Right, being in the home, I don't think I would ever change it. I worked in the clinic for years, and just trying to get carryover from the skills that you're trying to teach in the clinic to a person's home environment. It's so much easier when you're there and you're using their stuff, their couch, their equipment, everything that they have, so that they can video it or see it and be able to reproduce it very easily.
That's so true. And we know as physical therapists that carry over in different environments can itself be difficult, where I find so much more that the parents are seeing things like, oh, I can literally pull up the image of Rhea working with my kiddo at this ottoman or this coffee table or my fridge or maybe my glass doors, or using this cushion to help assist with this position. And so I don't have to work as hard mentally to be able to figure out how to do that exercise, because I can pick out all of these things that I literally can just see with my eyeballs, and all I have to do is then execute.
Yeah, and then oftentimes just working with them, like, to set up their environment and show them, like, here, let's put this cushion here, let's add these toys in this area. Once you do it a couple times with your child, oftentimes you can place that child there and then leave it and have your coffee and let them explore and do it in an environment that's set up to target their needs.
So, Rhea, you are seeing kiddos in the California area in that South Bay region, which, by the way, I don't know if I actually told you this, but I lived in Playa del Rey for a summer, and it happens to be the summer I actually met my husband. So I have like all the feels. Yeah.
But that's cute. It gives you like puppy love vibes there. You should come visit.
So now that we've talked a little bit about like why we both are absolutely obsessed with getting a physical therapist into the home, because it helps both the baby because they're comfortable in their environment, but then also eases the experience of the parent, both from a convenience standpoint, but also from like an effectiveness standpoint. What would you like parents in like Redondo Beach, Torrance, California to know about pediatric physical therapy and the things that you bring to your community?
Yeah, so I think one of the most important things that I try to drive home and teach parents is just the idea of not feeling like they have to fully commit to a physical therapy intervention, but more so just getting things cleared up or checked if they're feeling that their baby's not necessarily on the right track. I think, therapists talk a lot about the wait and see aspect of when they meet with their pediatrician. And so oftentimes parents will come to those baby well visits. And in those baby well visits, typically I think we've talked about this multiple times, Lauren, about how often like the actual FaceTime that you get with a pediatrician is between 20 and 25 minutes on average, which, in order to cover like growth and sleep and feeding and development in all aspects is pretty limited. And I think pediatricians do a great job of identifying red flags and making the necessary referrals. But oftentimes I think the motor side of things gets kind of shoved to the side, or not necessarily is always the first priority with these visits. And so a lot of times they'll bring up concerns about their baby not sitting independently yet, or not crawling, or showing signs of rolling, or having issues with their head shape. And I think that oftentimes they're told to wait and see, which I always stress to parents about this being probably a good sign, because it doesn't necessarily mean that their pediatrician is seeing a big red flag that necessitates treatment. But oftentimes the risk there and the pain point with therapists is that for a long while these children are just kind of waiting, and we're observing them, and then nothing's really happening in the meantime. And what happens if that development isn't on the trajectory, and then we've lost some time. So I always stress to parents that my biggest passion in this area is that instead of waiting and seeing, educate yourself and see. Set up your environment appropriately for your baby to progress, and get some tools in your toolkit via purposeful play activities and positions, and just some strategies that are evidence-based or evidence-informed and will help in that meantime or that waiting period. So oftentimes I will offer not just evaluations, but basically consultations for parents in this area who have these concerns, who just want to make sure that in that time that they're waiting to see if there's an issue, that they have the tools to provide their child to at least push them or give them a little bit of a boost in that direction, and then also stop any type of habits that they might be doing, like let's say overuse of containers that might be contributing to why this child's not developing in the way or at the speed or rate that they are expected to. So that's my biggest kind of soapbox.
I love it. I think the other thing too that's so interesting, it's not even just like the parents' habits that could potentially be contributing to not necessarily like global developmental delays, but these little like orthopedic type delays. So
Right.
things that parents like aren't necessarily being taught by anyone other than therapists is 60 minutes of tummy time total tolerance in a day by 3 months, or at least for sure by 4 months. So parents oftentimes don't even know. They just are getting this blanket statement of, oh, do tummy time every wake period. Okay, that's great. But like, let's define that a little bit more. Let's tease it out. Okay, if you're not able to do that, let's figure out some of the orthopedic considerations, because babies are humans too. They get broken clavicles during birth and they're all twisted and smushed in the, birth canal, but we're not seeing it in the way that we could be influencing how that body moves in order to enhance it towards optimal movement, not just common movement.
Yeah, I mean, I think the word optimal is key there. I think that as physical therapists, that really is one of our biggest missions, is optimizing movement. And I worked in kind of the neurological setting for years prior to jumping right into peds. And, I don't think that any neuro-minded therapist could kind of witness the first 0 to 3 years of development and not just kind of become crazy obsessed with it, because there is so much change on a neurological level in those first 3 years. And there's so many things that kind of get set in stone that will affect how that human moves the rest of their lives. And if you look at our population now, the amount that we value movement is kind of slowly declining throughout. There's less PE in schools, people have more sedentary jobs, there's a huge opioid problem because people are in chronic pain. I think that we have a very unique window of time and opportunity, especially in young childhood or early childhood, where we can influence and optimize movement that could make huge changes. And so I really, really stress that to parents too, is that oftentimes someone without a trained eye will look and say, oh, that's fine. Like your baby, babies skip crawling all the time. It's no big deal. But it's like, are we really truly optimizing movement? And if we're not, how is that affecting development throughout the rest of their lives? So I really, try, at least for my clients, and you bring up orthopedic issues as well. Plagiocephaly or flat spots on the head, we know is affecting like 46, I think, is the percentage of babies, research is showing. And no one's really training parents to monitor head shape or look for it. And no one's really training parents that are expecting to look for like a head turn preference that might cause tightness throughout their entire body, that might transcend to issues and low quality of motor skills throughout the rest of their development. So, there's so much going on in that time. And I want to be able to educate as many people in the community that I can.
I love that. And on that note, I would love to go to your website. Is that okay?
Yeah, of course.
So for that mama who has found this interview on YouTube and she's like, oh, Rhea's vibe as a pediatric physical therapist is just so calming. I feel like it would just be the perfect fit for my family. And we're in, one of those locations like Torrance, California, or Redondo Beach, California, or Hermosa Beach, California, wherever, kind of any of those locations for everyone who is looking at this too right now. They're all listed right there. And she's like, all right, I'm in, I'm sold. I would love to get a pediatric physical therapy evaluation or like a movement evaluation by Rhea. Rhea, how does that mama go about scheduling with you?
I have a contact button on the website, and you can write a small message to me. And usually what I do is I set up a call where we are talking a little bit about what exactly your concerns are and what they're looking for, to make sure that it's a good fit both ways. Some kiddos, it's a little bit more appropriate to be seen in a clinic for certain reasons, or, it might not be a good fit for any other reasons. But I just want to make sure before scheduling that the mom or dad feels comfortable scheduling with me. They feel like it's a good fit. We can come up with a plan together, and then I'm also hearing them out and figuring out, what type of concerns they're having, to make sure that PT is the first right step as well. So really, I like to have a conversation, which when I started my business, I was finding that parents were surprised that someone is actually wanting to listen to them.
I know! I get that all the time too.
Yeah, which my own experience as a parent, like, I totally understand, because as a mom, I found that, like, anytime I've taken my daughter to an appointment, I constantly am feeling rushed through my sentences and rushed through my concerns. And it's not necessarily an indication of a bad practitioner, but it's just a system. And the system right now is set up on an adult model where we're running through patients throughout the day, and we're trying to, practitioners, PTs, doctors, everyone's just trying to juggle a humongous caseload. And so for me, I keep my caseload intentionally small so that I feel like I'm meeting the needs of the babies and the families. And I want to hear with them, and I want to connect, and I want to actually feel like we're making big changes. I don't want to feel like we are both overwhelmed and rushing through the process.
I love that. I call all of my families too, regardless of how they, try to book with me for that initial evaluation. And I find that, like, there's so much value we can even provide families immediately upon that phone call, just by asking a couple of questions. Okay, yep. I know we haven't scheduled, we have you scheduled for, 2 days from now, a week from now, whatever it happens. But in the meantime, maybe try a couple of these things that are safe, easy, effective, and don't necessarily need a ton of, direct input from me. So we can start seeing changes like tonight.
Absolutely. Yeah. It's nice too, because you come to the house and you start your evaluation, and you don't have to spend 30 minutes on a subjective interview with the patient, which, feels so repetitive to parents, because they've filled out an intake form, they've had conversations, it's like they have to explain the same stories over and over again. And so I find when we have that call, we're getting in and starting and just clearing up any information we need to, but it's a helpful thing.
As far as services go, you have a couple of different options for families that we've kind of already talked about, but on your website, I feel like you do an amazing job of breaking them down between physical therapy services and wellness services. Rhea, would you chat a little bit about maybe the difference between the physical therapy services and the wellness services?
The physical therapy services are typically geared towards families and babies that have kind of a known diagnosis or a known issue that the pediatrician is agreeable and kind of wanting to address right away. So that is set up in the way of, we do a 60-minute initial evaluation where I come in, we discuss history, and then I do some observations of baby playing, and we come together collaboratively and come up with a treatment plan or a plan of care. And then those follow-up visits are 60 minutes as well, and that's me coming into the home, and we're carrying out the physical therapy or the skilled intervention, and it's collaborative with the parent or caregiver, whoever is there with me, so that I make sure that they're getting their hands on the patient, they're feeling it, they're carrying out the intervention as well, so that when I leave, they're only in therapy for 3% of their entire week. All of the other times I can't just send my hands home with them. I can through the parent or through the caregiver. So there's a really, really high focus in making sure that the parents know exactly how to implement that stuff throughout the week. And then as far as wellness services go, I offer a few things, primarily the consultations that we discussed earlier, looking at milestones. I can come in and do an assessment and take a look at where your baby is on like the percentile of their motor skills. Like, are they in a range that is kind of acceptable, where like they're just going to continue to need some encouragement? Is it something that will probably warrant skilled intervention, or is it something that, like, with a little bit of a boost and some tools and some changes in the environment, mom or dad can handle at home? And then I also do a tummy time troubles assessment, and that's just basically for kind of the frustrated parent who feels like they're trying their best to give their child floor time, and they just don't tolerate it, which so often, babies can absolutely hate it. So I work with the parent one-on-one on altering their setup and using, whether it be like a boppy or a towel roll or the parent's body, whatever it might be, to figure out ways that they can provide a motor enriching experience that isn't making both of them cry.
Right. And we know that tummy time, again, like we kind of addressed earlier, is so important, but can be heartbreaking for parents, right? Like, they're like, I know this is good for you, but I just emotionally can't let you cry it out. Like, there's gotta be an easier way. And I love that you have this offering, because oftentimes there is easier ways. Like, maybe it's where the elbow or the shoulder position is. Maybe it's just a hand placement to give them assistance at a certain area. Maybe it's addressing the fact that, oh, it does look like your kiddo has some tightness in the front of their neck. Is this something that we could just add in a different exercise for? Or is this something that, really looks fairly significant, and then you give them more information so that they can make a better choice as far as like next steps go.
Yeah, absolutely. And I find that babies with reflux too is such a big issue right now. I'm seeing so many kiddos with GI immaturity and things like that really need those accommodations for tummy time, whether it be changes in the schedule of their wake windows or positioning to help them tolerate it, so that once their GI system matures and things are digested a little bit more, they're not 2 to 3 months behind on their motor skills because they were never able to tolerate that position.
Yeah, because you do, just for parents who maybe haven't heard this before, you do need that shoulder strength. So when you're on tummy time, your elbows are pushing through the ground in order for you to lift your head and neck up off of the ground. So gravity is pushing your head forward, so you have to activate the back of your neck muscles in order to hold your head up, but you also have to be pushing through those elbows. And if you have tightness or difficulty with that, it's going to make it more difficult. But if you then don't, maybe spend more of your time on your back or your side, you're not getting that elbow or that shoulder and upper trunk strengthening, and so then rolling from belly to back, or truthfully back to belly, because you do need to be able to move those limbs against gravity in order to reach those milestones. And then plus, obviously, it's our biggest contributor to head control as well. So obviously we need head control before we can sit independently. So there's a lot of reasons why tummy time is such an important thing to consider, but also there are so many things you as parents can do to make the experience with tummy time a lot easier and more tolerable. Maybe even fun.
Maybe, eventually.
Sometimes I find that babies just don't seem to feel really comfortable in their bodies, and those manual techniques, whether it's infant massage or something slightly different, can really calm their nervous system and really get those muscles gliding better on each other, which then can increase range of motion as well as just general happiness in babies.
Yeah. There's so many benefits to infant massage, and I recently got certified to teach it. I think it's such a powerful tool for parents, and not just for infants that, let's say, had a complicated birth or have something else going on, but for any infant. It gives them that sensory input that helps calm them. They've shown that it stimulates the vagus nerve. Infants who have issues with weight gain, especially like babies born premature, they will gain weight faster when they have received regular infant massage. It's helpful for babies with colic and digestive issues. There are techniques specifically for constipation to get things going, and for adults too. So check out Lauren Baker on YouTube. If you want to learn some of those techniques.
Oh, so true.
Everybody benefits from massage, and there's been such a societal shift to like not touching your baby. Put them in this, put them in that, turn that on. It'll rock for them. Do this, do that, so that you can go back to work in 2 months. The value that we place in just receiving and giving touch is so much lower, and it's not really changing overall, although there are more parents seeking infant massage out, and it's just a really incredible way that moms can bond with their babies, dads can bond with their babies, any type of caregivers. I have twins right now, and the grandparents do regular infant massage for them, and it has just been like an incredible way for them to bond, and it's made humongous changes in just that baby's overall body tension and ability to move. And I've seen improvements in their like motor skill progression just from doing that regularly too.
Oh, I do a ton of manual too, not quite the same as you, so I hope that I can get you back on to even just like teach me more of your skills in that area. But I see, oh my gosh, just so much change in babies, and then also just it's calming too, like those repetitive strokes for parents. Like there's something about feeling through your fingers and connecting with another person that really is a calming experience. And if you're a parent and you can see that you have a positive effect on your child in a different way, that's also so empowering, because then you feel like, okay, like I was able to learn this, and now I have another tool in my toolbox in order to assist my kiddo in experiencing life in a more calm and confident manner.
Yeah, and when I teach these techniques, the biggest thing that I stress with parents is that they need to, it's really not necessarily about getting through the strokes, doing the sequence exactly how it was meant to be, but it's more about feeding off of their child and responding to their cues and shifting the way you're handling or positioning based on how your child's responding. So it's just such a great activity for this like give and return relationship to start as soon as they're like on planet Earth, like on this side, out of the belly. You would start as soon as they're here. So it's there's not a lot of things that you can do with a newborn that give you that type of like feeling or relationship. And it's great for sleep too. And what parent doesn't need more sleep?
More sleep. For sure. Rhea, well, it's been amazing having you on. I did want to kind of real quick go through your Instagram, because I know you have a bunch of really awesome things for families, and I even see an infant massage one here. So will you tell us a little bit about your Instagram and where people can find you?
Yeah, I'm most active on Instagram. I've taken the summer off to give myself a little time to enjoy my own kids. I'm on Instagram and on TikTok. We're making that jump soon, so keep your eye out. You can find me there. That's probably the best way to get some of the information that I've been putting out there. And really, I'm just trying to provide some simple, actionable tips that you can look at and easily implement at home during playtime with your baby to kind of get them on the right track.
I loved this one. I thought this one was great. Let's see if we can play it, where you put the Cheerio in the drawer. I was like, oh, brilliant. For everyone who is new to Rhea, she is so creative. So you're definitely going to learn new kind of out of the box ideas from her, and really like cute, fun tools too. So definitely go ahead and follow her at Grow Well PT. All right, Rhea, is there anything else that you would like to tell the beautiful parents of YouTube and about your business, about yourself?
I would like to tell the parents of YouTube that they're doing a great job, because no one ever tells you that as a mom. Everyone is quick to tell you exactly what you should be doing. And, you know, just take a big deep breath and know that, like, you don't have to do it all. You don't have to know it all. You don't have to research everything, because if you do that, your head is going to be spinning. There's so much information out there. I think it's great that you're doing this, Lauren, to showcase the therapists that are out there to come to the home and actually, you know, listen and help. So thank you for having me. But just like parents know that you can find some answers and some help and some peace of mind. You don't need to lose too much sleep on top of all of the sleep you're already losing.
I love it. Well, everyone, make sure you check the description down below. I'll have links to all of Rhea's information, her website, Instagram, as well as ways you can get into contact with her. And if you are in the Redondo Beach, California area, looking for a pediatric physical therapist to come to the home, or any of those other areas that we listed, make sure that you look up Rhea, because I'm a little jealous because I love her, and I hope that you guys love her too.
Thank you, Lauren. We love you too.